Let's see here. Perfect. So welcome, Jane and Liz. I know that your bios were included in your invitation, but hoping you might just do a brief bio for those in attendance. And before we get started, I just want to thank you both for sharing your time and knowledge with us this evening.
Hi, well, welcome everyone. I'm Jane Epstein. I'm a nurse practitioner. I use she, her pronouns, and please just call me Jane. I did adolescent medicine for about 30 years. I now do some women's health, and I've spent the last couple of years doing some research on and writing on women's sexuality. So I have a blog at janeepstein.com. Liz?
My name is Elizabeth. I also go by Liz. I'm a nurse practitioner at the UNM Cancer Center in gynecologic oncology. And I have a special interest in sexual health, which I started getting interested in working with that population of women. And that's it.
Okay. So first off, I just want to acknowledge that I have not had cancer or any major illness that affects the landscape of my body and my sexuality. So I have a lot of respect for the journeys that you're going through, and come to you with a talk somewhat humbly. If nothing else, I truly believe that talking about sexuality helps us to talk more about sexuality. So hopefully tonight we'll catalyze some conversations in the future for you folks between each other and with your friends and your partners and your healthcare providers. So the goal tonight is to give you some information. We will hopefully have plenty of time for your questions. I want you to hear from each other, and we hope that you'll get some new vocabulary, some new insight, some new possibilities regarding your sexuality and your sexual relationships. So we're going to briefly lay out some of the common challenges, and then we're going to focus on interventions, and we'll open it up to questions. Liz and I will talk for about 30 minutes, and so we should have plenty of time. So I'm going to start with the challenges, and with the caveat that everyone's journey through breast cancer is super unique, and that in pairing with sexuality is super unique because sexuality is very complex. We call sexuality a biopsychosocial phenomenon, meaning it has a biological aspect for sure, but it's also very influenced by our brains, and it's a social phenomenon. So breast cancer and breast cancer treatment affects our sexuality on myriad levels. On the biologic level, and again, I'm just going to kind of run through this, SERMs like tamoxifen and the aromatase inhibitors decrease the action of estrogen, and that can bring on some of the symptoms of menopause, like hot flashes, changes to the vaginal tissue and the whole genital urinary area, the labia, etc. If you've had your ovaries removed, that's a more dramatic entrance into menopause than natural menopause. Certainly the aromatase inhibitors can have more of an effect than tamoxifen. And all those effects, and this is where we want to share that graphic, Allison. Liz has a good graphic here of how the decreased action of estrogen affects the vaginal mucosa and the external genital urinary area.
So I am definitely a visual learner, and that's why I like this picture. So on the left, you can see the vaginal tissues where there's a normal amount of estrogen, so premenopausal, and then on the right is a low estrogen state, and you can see the difference in the vaginal tissue is thinner on the right, and it also has lost that kind of wave appearance, and that wave is what we call rugae, and it helps with the flexibility of the tissues. So when you have a low estrogen environment, that flexibility of the tissue is not as much, and then you have what's called atrophy, so the thinning of the tissue and less flexibility.
So other medications, thanks, you can stop the screen share. Other medications affect our sexuality as well. And these may not be medications that you're directly taking for breast cancer, but things like antidepressants certainly affect sexual desire and sexual function. And other medications like, medications for blood pressure issues and other health conditions that you have. Certainly fatigue affects our sexuality. We all know that. And then there's the obvious, you can stop sharing, Allison. There's the obvious sequela of having a mastectomy or breast surgeries. Not only does it change your sense of your body, but it can cause a loss of that erogenous pleasure from nipple stimulation. Psychologically, there's the stress, there's the fear, there's the burdens on your time and finances, there's changes in your body image, due not just to the surgeries, but sometimes weight gain associated with the treatments. Socially, you've got a new, uninvited, constant companion in your relationship. And when it comes to talking with your partner about sex, that can be challenging enough for any of us. But then you add the fact that your sexuality may be changing, and it's hard to know what to say when you're not even sure you know yourself, how you feel or what you want. There's also that dynamic where you might be walking on eggshells with each other because you're trying to take care of each other in the relationship and not hurt each other's feelings. So that's just a quick rundown. We're going to move on to the interventions. And I just want to acknowledge that we're kind of stabbing at the low-hanging fruit here. And we'll give you some very concrete suggestions and stuff, but the really tough stuff is like how to lovingly accept your body as beautiful and whole and sexual, and how to juggle the demands on your life and the fatigue and the worry. And there's less concrete quick fixes for that. So with that in mind, again, we kind of humbly offer you some products and practices. So we'll start with the biological, and then we'll go into the psycho and social together. So biologically, the SERMs and the aromatase inhibitors have side effects if you're on those, or if you're just naturally in menopause. So the first two things that we're going to talk about are moisturizers and lubricants.
So I'll take over to talk a little bit about that. So moisturizers and lubricants are two different things, and they're used at different times. The lubricants are used for sexual activity and only during that time when you're having sexual activity. There are water-based, silicone-based, and oil-based lubricants. And we could spend probably the whole hour and a half talking about them. But the takeaway is that if you are using any toys like vibrators, dildos, if you're using condoms, then you want to use probably a water-based lubricant, because that's the type of lubricant that's not going to ruin those things and is going to keep the materials complete. If you're not using any toys, then I would recommend a silicone-based lubricant. The silicone-based lubricant lasts a little bit longer, so you don't have to reapply as much, and it kind of mimics our own body's vaginal lubrication a little bit closer than I would say the water lubricant. And then finally, the oil lubricants. Again, you don't want to use those if you're using any kind of product, but it is an opportunity to use those. I will say that the oil lubricants, you can use natural oil like you would have in the kitchen, for example, coconut oil or even olive oil. There has been some mixed well, I wouldn't say mixed, but it's difficult to find the evidence-based information on home oils because there's just no money in it. But from everything that I could read, there's no contraindication, meaning that there's nothing that says that you cannot use those natural oils for lubrication. And again, all of this is used during sexual activity. Now, moisturizer, on the other hand, those are used for not necessarily for sexual activity. So even if you're not partnered, even if you're not having, sexual activity with yourself, and you're not doing, if you're not sexually active at all, you can still use moisturizers. And what they do is they help with the vaginal mucosa in terms of prevention of that atrophy, like the picture that we showed you earlier. And I kind of explain it like you get out of the shower and you moisturize your skin because we live in the desert and we're dry. And so that helps our skin stay kind of moist and not so dry. And so the moisturizers do the same thing. And you want to start by using them every night for 2 weeks. And then you can do it less frequently and see if your vaginal mucosa stays less dry and it still feels okay, and go up if you need to, or go down. There's tons of different lubricants and moisturizers. So I'm going to have Allison share with you a list. And the list is something that I compiled that are safe according to the World Health Organization, safe for your vaginal mucosa, because not everything that you put inside, not all lubricants are created equal. But I will say that if, because the safest ones tend to be a little bit more expensive, if you need to do something that's not quote unquote safe, it's still better than nothing, because not using any lubricant can put you at risk for tears and discomfort.
And the ones that contain an ingredient called hyaluronic acid, HYALURONIC, I think that's right, or hyaluronate or something you'll see in the ingredient. Those are more expensive, but they're super effective. And there's been studies on them, on how much that particular ingredient will cause the tissue to absorb more and retain more moisture. So it keeps your vagina healthy, and it then hurts less. So speaking of pain.
I'm sorry to interject. I just didn't know, and I didn't want to cut Liz off. Does she now want me to put up the list, or at a later time?
You can email it to the group if you want, and that way it'll be less, distracting, but I don't think they need it right now.
Okay, great. Thank you.
Yeah, thanks. So pain with intercourse is not uncommon when you're having menopausal symptoms, and it's because of the changes to those tissues. One item that is available is lidocaine. Lidocaine is it's like Novocaine that you get for your teeth, right? And you can buy it over the counter. It's a topical agent. There's hemorrhoidal creams that have lidocaine in them. There's ointments, and you can put it just around the outside of the vagina. And especially if you do it a little bit before penetration, you can even then wipe it off before penetration. It will have soaked into your tissue, but then it won't get, if you're having sex with someone with a penis, it's not going to get on the penis. And it will help with that initial pain of penetration. So you're not putting it way up in the vagina, you're just putting it on those outside tissues just for penetration. You want to be careful you don't get it on the clitoris. You don't want to numb out your clitoris, but you can try that. You can also get a prescription for it. There's also something called pelvic physical therapy. Physical therapy for the vagina. Yeah, it exists. And it's fairly awesome. So there are physical therapists that are specifically trained in this, and you can look up pelvic physical therapist Albuquerque and find them. And this is really helpful on many levels. So personally, I have done this, so I can vouch for it. And I was shocked at how good it was. So we want to improve blood flow to the vagina. That keeps those tissues healthy, right? And Physical therapy helps us do that. It helps strengthen weak pelvic floor muscles, and it helps relax pelvic floor muscles that are too tight, which both can be associated with pain with intercourse. Making those pelvic muscles work better can improve orgasm and sexual function. And it's amazing what one can learn. We all have heard the word Kegels or Kegels, and we're all supposed to do them, but like, how do you know if you're doing them right? Right? It's kind of a mystery. And the pelvic physical therapists are like, no, this is the part you want to tighten. And you're like, oh, got it. Okay. Speaking of pelvic physical therapists and blood flow, self-stimulation or partner stimulation is also super helpful. Liz?
So I was going to add one more thing to the pelvic floor PT. Even though this is a sexual health talk, I think urinary incontinence, which is like leakage, or like, you sneeze or you cough and you have a little leakage, or you have urgency, so you have to pee and you have to go right away. That can also be helped with pelvic floor physical therapy. So just another benefit of it. So talking about blood flow and keeping those vaginal tissues healthy, like Jane said, stimulation is a great way of doing that. It's free, well, depending on what you're using, and it can help us get back into our bodies a little bit. So there's 4 different stimulations. One's with a dilator, one is with a partner, one is with yourself, and one is with a toy. So I'll start talking about the dilators. Dilators are a medical tool, and they're about so big, and they have different widths. So they start very, very thin, like a pen, and then they get slightly bigger and bigger and bigger.
But not that big.
Not that big, yeah. And they are a great way of very slowly stretching those tissues and bringing the blood flow to them. And if you're interested in that, you can talk more with your providers or ask us at the end. The other option is, of course, with yourself or with a toy like a vibrator. Most women, 80% of women, experience orgasm through the clitoris. So knowing that, having a focus on that area, learning what your body feels like, and then with a partner. And so with all 4 of these stimulations, you definitely want to be using lubricant with all 4 of these, and significant amount of lubricant. And then just remember what I said about which lubricants you're using, depending on whether or not you're using toys.
Cool. Laser treatment is another option. It's laser to the vaginal tissue and the external tissue. Insurance doesn't pay for it. Studies are still being conducted on its evidence base, but most women find quite a bit of relief with 3 treatments. They're painless, but they do find that they will need additional treatments, like they need to, like a buff up treatment, boosters. They need booster treatments. So one of the low-hanging fruit is, if you're having any irritation on the external genitalia, is just making sure that you're eliminating any irritants. So not using any perfumed products, gentle soaps. If you're having any urinary leakage or incontinence, it's advised to use not menstrual pads, but urinary incontinence pads. Who knew? They're different. And the urinary continence pads are better at keeping the moisture away from your tissue, because the urine is irritating to that tissue. And next and last for all this, like how to take care of your vagina talk, is I want to put vaginal estrogen on the table. And I know that's controversial, but not everyone has estrogen sensitive breast cancer, first of all. And estrogen to the vagina for folks without a breast cancer diagnosis, it is the most effective thing for the vaginal tissues is direct vaginal estrogen. The systemic absorption from vaginal estrogen is in the low part of the menopausal range. It doesn't even get into the mid to upper range of the menopausal level of estrogen. So the thing with aromatase inhibitors is that they are looking to get that estrogen even below menopausal range. So having your estrogen even on the dial, the needle lifting a little bit is not favorable. When it should be on the table as a topic of conversation with your doctors is if you've tried all these other things and you're still super miserable, like it is really, really affecting your quality of life. If your cancer is stage 1 or stage 2, or it's stage 4 and you're terminal, if you're using tamoxifen versus an aromatase inhibitor, and there's other things. Post breast cancer treatment, it's used not infrequently for people with severe symptoms. And so that can be a topic of conversation later, but and now I want to talk a little bit, shift here to the psychosocial part. And first up there is counseling. And I don't know what you know about sex therapists, but sex therapists can either be therapists who just can go into those waters and talk about sex, or they can be certified therapists. There's a couple of certifying agencies. The most commonly used is AASECT. It's AASECT. And you can go on their website and type in your zip code, and you'll find 3 in Albuquerque that are AASECT certified. And there's still this thought out there sometimes that sex therapists are gonna like maybe have you have sex in the office or just talk about sexual positions or whatever. It's just including sexuality in therapy. And Liz, please take it away from here.
So I wanted to talk a little bit about sensuality, and that's kind of feeling sexual or sensual with yourself. And I think there's a lot of importance in regaining that if you don't have that, or strengthening that if you have it and you just feel like you need a little oomph. And so what can do that? And I think that there's, we always talk about our senses. And so thinking about what things make us feel sexy. So certain clothing, I mean, when was the last time that you bought underwear that made you feel sexy? Has it been a decade? Has it been a year? And what scents make you feel sexy? I mean, is it like vanilla? Is it sandalwood? Like what the lighting around you, and kind of just self-care. So taking time for yourself, maybe drawing a bath and having your, the lighting just right, music. So just thinking about all the senses and thinking about yourself as a sexual person and how do you woo yourself is really important. And then of course, masturbation, like we talked about, isn't just for bringing the blood flow to those tissues, but also feeling like a sexual person and feeling empowered. So I think all those things can make you feel really good with yourself. And then thinking about the differences between sensual and sexual, and like what things can you do that make you feel sensual, maybe with your partner and without, and what things make you feel sexual with your partner and without. And one of the things that I really like is something called the 3-minute game. It was kind of specialized, or it was not originally made by Betty Martin, but she's the one who really brought it to the forefront. And Betty Martin made this game to allow you to kind of practice and explore physical intimacy with your partner without the pressure of sex. And eventually you can bring in that to the game, but the initial game is just about how you can explore intimacy with another person doesn't even have to be your partner. And Jane actually has on her website, janeepstein.com, she has like a little blurb about the 3-minute game, and then the link that brings you to an intro about how to do the 3-minute game with your partner. It's exactly that. It's short, 3 minutes, 6 minutes, I guess. But yeah, so that's a really great
It's
list.
really awesome.
Yeah,
it's really,
great
really
list.
worth exploring. And you can do this if you don't have a partner. You can do it with a friend that you feel comfortable with. You can do it with your child. And yeah, that's all we can tell you. You got to check it out.
So I'll go back to Jane.
In terms of reinvigorating your sexual practice with your partner, another thing, and this is also up on my website, but is called a yes, no, maybe checklist. And a yes, no, maybe checklists were originally created for the kink community and folks into BDSM, where they could say, all right, these are the things that I'm into. What are you into? So it's a list of sexual practices. And for each thing, like, you know, oral sex. So receiving oral sex, you would say, yes, I'm into that. Or no, not in my repertoire. Or maybe, you know, under certain circumstances, I'd be into receiving oral sex. So you go through this list and you do it by yourself, and then your partner does it by themselves, and then you share. And it's really to start conversation. And I think when your sexuality is changing, when your body is changing, like the yes, no, maybe checklist that I have on my website is not for the kink community or the BDSM community. I wanted to call it the yes, no, maybe checklist for the rest of us. But I think when, you know, are you comfortable having a partner touch your affected breast, or touch your belly right now, or be naked at all with your partner? So it's anyway, check it out. It's up on the website, and you'll find a link to it from the blog. Other things that can help you explore your sexuality are things like erotica and pornography. So to be super gendered about it here, I mean, guys are more into visual pornography, and women seem to often be attracted to literotica, or erotica that's written, that they can read and use their own internal images. And there's so much out there. So to find it, you can Google feminist erotica, for example, and you'll find lots of sites with erotica written by women for women that's free. And, you know, the fact is, when we think about sex, we want to have sex more. And when your life is super full and stressed, you don't really have a lot of space to think about sex. So just sitting down and reading about something that kind of turns you on, or watching pornography. And again, you can Google feminist pornography if you want something that isn't all about, you know, they call it the male gaze, just like the sex scene through the guy's eyes, you know, heterosexual looking down from his body. You're going to find different stuff out there, and pornography that's been ethically created, the way they're hiring techniques and filming and stuff. Erika Lust, ErikaLust, is one of the directors that has a lot. And Else Cinema is kind of a spin-off of hers, ELSE, which is even a softer pornography than most of her stuff. And then there's always apps.
I'll talk a little bit about something called the Rosie app. It's a ROSY app. So this app does cost money. I believe it's a monthly subscription, not prescription.
Yeah, you can access it for free, but you get a lot more out of it. It's $10 a month.
Yeah, so I think, if you're not sure, you can do the free app to begin with, but basically it has a little bit of everything. So it has some erotica on there. It has support groups. It has online sexual therapists. It has articles about sex. It has checklists and kind of forms that you can fill out and say, this is where I'm at right now in my sexual health, and then later take one again and kind of compare where you're at and where you've been. So I believe it's one of the very few apps. I don't know of any other app that's doing something quite like that, and it was originally made by this female gynecologist. So it's a good resource to have.
It's fairly phenomenal. And my guess, I'm not super versed in it, but my guess is that you would find groups of other breast cancer survivors talking about sexuality. So, and I think that is all we really had that was prepared. And we really wanted to leave time to hear your questions and talk. And if you would like to ask questions anonymously, you can type them to me or to Elizabeth. And
oops, I'm not.
I'll know who you are. But...
I'm Rosanna. Hello.
Hi.
Hi, Rosanna.
So I have any specific questions, but I just know that, yeah, things change. They've changed, and yeah, it's pretty interesting.
Annie, did you have a question?
I did. So you were talking about the I'm sorry, I was taking notes. So you were talking about the lubrication. Mm-hmm. And you were saying that the silicone-based lubrication is probably, that one's better to use if you're using that with a partner, opposed to if you're using toys or things like that. Is that correct?
Yeah. Okay. So if you're using toys, you want to stay away from silicone because it can break down the materials. Right. And it just lasts a little bit longer than the water-based lubricant. So that's the benefit of using it, but many people use water-based with a partner as well.
The silicone lubricant is kind of amazing. And if your toys are glass or metal, or, they make dildos and lots of different materials, it's fine to use silicone. It's really just if you're using a silicone toy or a plastic too, Liz?
Yeah, well, plastic toys are not great to begin with. I would recommend using silicone anyway, because plastic toys they're making better plastics now, but they have more absorptive qualities, so you can't sterilize them like you can with silicone. But I don't know to be honest, I don't know if silicone and plastic are okay to be used together, because I think I tend to recommend against plastics to begin with. But I would say that if you had any questions or concerns, one resource that I didn't share with you all was Self-Serve. I don't know if any of you know that, but it's a Albuquerque woman-owned sexual resource center on Morningside off of Central, just east of Nob Hill. And they're really great. They sell lubricants, they sell toys, they have classes. And so if you have questions about lubricants or toys, they're really awesome. And everything that they sell is tested on their employees mostly first. And they sell things that are healthy for the vaginal tissue. So I would recommend that if you feel comfortable doing that.
And
Okay.
Hunter from Self Serve talked to Pink Warrior House,
Oh,
and her
great.
video, she's very good, and her video is on the YouTube channel. So if you want to know about dilators and lubricants in great detail, you go look at that video. It's
Okay.
awesome.
And so I had another regarding the lubricants.
Mhm.
So I know this might be like a funny, weird question, but what is better as far as, because of the medications that I'm taking and as many as I'm taking,
Mhm.
I tend my I smell like medicine. Like
Mhm.
Mm.
you know, of course my urine smells like medicine, but so does my vagina. Even just it just smells like medicine. So what it is, I would think that a water lubricant would make that not worse, but wouldn't it? Which one would not bring it? Which one would help as far as the medicine smell?
I honestly don't think that there would be a difference in terms of that medicine smell. You know, you're getting that scent because it's a systemic, like meaning through your whole body medication, and it's just you're gonna sweat it out. Like when you eat garlic, you're gonna smell like garlic. And so unfortunately, there's nothing that's gonna make that go away, but there's also it shouldn't make it worse. I will
Okay.
say you bring up a good point. Some people's vaginal tissues are more sensitive to certain lubricants than others. So if you get a lubrication, say you get, you know, Sutil, which is what I usually I love that one the best. So say you buy Sutil, it's a lubricant, and you use it, and you're itchy. You're really itchy afterwards.
Or
Don't give up.
burning.
Yeah, if you're burning or itching or whatever, don't give up. Just get another lubricant. So if you do notice, you know, that you have a different smell, get a different lubricant. But I don't think it would make a difference in terms of like water-based or silicone-based. That's a great question.
Okay.
And,
So,
you know, there are some that have flavors in them. Generally, those aren't great for your vaginal tissue. You could try it, but most of them are flavorless and odorless by
The
themselves.
last time I tried one, it was yeah, I ended up smelling like cotton candy and medicine. So it didn't, you know.
Yeah. Yeah.
So-
And not a dumb
Really, it
question.
didn't kill it. It didn't really help. So
It's
Yeah, I do.
so, sorry.
Oh, I was just going to say, it is not a dumb question, Annie. And I do hope that you all, like, there are no dumb questions. And like, if you're going to go for it here. Just ask what you want to ask. Yeah.
okay.
I just wanted to say that I worked on a labor and delivery unit for 5.5 years, and then now I'm doing gynecologic oncology, and I can't count on my fingers and toes how many women have said to me, I feel like I smell funny down there. And how many times I've been all up in their business and it does not smell funny. And so I think we're our own worst enemies, right? So I'm not saying you don't smell different. You probably do, but most people, like your partner, probably won't be able to smell it like you do.
Okay. Okay.
I have two questions. So Liz, on kind of what you were just going over on the different lubricants, I'm thinking, okay, you try one, it doesn't work for you, you try another, and now you have this, like, you've amassed a collection. Are there any places or options that have samples that you can try before you commit to one or the other?
Yeah, so self-serve, that store that I told you about in Albuquerque,
With Hunter?
yeah, they used to, and things have changed a little bit with COVID, but they used to let you go in and actually feel them, so you can at least feel all them and be like, oh, I like this, or oh, it's too runny or whatever. And then they sell like little, I'm pretty sure they still do. They used to sell like a little package of like multiple ones, so you can try a whole bunch. But even if they don't have the multiple ones all in one package, you can still buy little samples. I asked
Little
them,
one-use packets. Yeah.
yeah, one-use packets. So
Yeah.
Great.
And
Okay.
if we had been in person, I would have given you some samples.
Well, although Jane, I mean, I know we wanted to be, but with COVID numbers, we couldn't be. But if you have samples, I can put them out in the bowl at Pink Warrior House so that when
Okay.
people come for different things, they can help themselves and try different options. So just know, Annie's excited about that. Yeah. So,
I'll go.
So we can definitely connect. I can swing by and pick them up. You can drop them off at Concordia House, but just know, even though we weren't live tonight, I can still make that option.
Great,
available.
that'd be great. That'd be great.
Okay. And then I'm sorry, the other part of my question. So I went ahead and I'm sorry, my dog is barking in the background. I added you, Jane and Liz, to the invitation for tonight in Hobnob. And then I engaged the chat feature, and I went ahead and posted your diagram as a photo in there so everyone has access to it. But I just wanted to clarify, Jane, I know you kind of mentioned this a little bit, but for, just so we can get it in the recording in case anybody watches it and goes back and looks at the diagram, the first 3 things that are listed in other options are estrogen replacement, an estrogen receptor, and testosterone. So how would you recommend, because the vast majority of the women in this group are estrogen receptor positive, because most breast cancers are, how is that a conversation for your oncologist, for your gynecologist? I really want to make sure we get that out there, because for some of our group, it may not be as safe as it is for others.
Right. I didn't quite get your question. It was because I heard testosterone and
right. I was just looking at the sheet that I posted, and the first 3 things in other options are hormone based. And so I just want to be, I know you kind of glazed over the fact that some women are estrogen receptor positive, but I know that, the vast majority of breast cancers are. If you were interested in one of these options, what would be your next steps? Would you go to your oncologist first, to your gynecologist? Yes. I want to make sure we're giving good information, because that one is really particular to this group.
Sure. So Liz, jump in if you have nuance to add here. But so I just wanted to put estrogen on the table. I don't know what's on Liz's sheet, and the ossifeme, I don't even know how to pronounce it, and testosterone, there's probably less evidence on using those in breast cancer, but vaginal tablets and the vaginal ring, both the use of those will usually end up in estrogen levels around 5, and menopause is in the 5 to 20 range of estrogen. I don't know the units. Again, with aromatase inhibitors, you're going for less than 5. So it's an option to be discussed with your doctor if you have tried all the other things, or a lot of them, you are miserable, your breast cancer is of a certain type. I had mentioned stage 1 or stage 2, or you're on tamoxifen or a SERM and not an AI. So I just wanted to put it out there. It is a conversation that you would have with your oncologist.
Thank you for the clarification.
I have a question, and I think I sort of put this out to everyone if anybody has any ideas. I feel like one of my big issues is that I kind of have forgotten about sex. And, I don't know, like it used to be something I thought of. I was like, and now it's just like, oh shit, I wonder if my husband's doing okay, because we haven't had sex in, a week or 2 weeks or 3 weeks or whatever. And I just was wondering if anybody had any ideas. I mean, I guess I could put a reminder in my phone, but, maybe something a little more or a little less contrived. I don't know, if I would just love some ideas.
I have some ideas, but I'd love to hear from other folks.
Alex, if your phone starts to go off saying, it's time for sex, it's time for sex, it's time for sex, then it's probably time for sex. But
yeah, then it is. Or I'll know it's you hassling me, Annie. Alex, have
I'll
you had
text
sex
you.
today?
I'm going to start texting you every 2 days. That's a good question. That's a good question, because, aside from COVID and breast cancer and, hoping that my next test is clean, I can't, it's hard to think about sex. It's hard to, the way that I get reminded is by the husband.
Yeah.
I'll get that look sometimes, you know, but sometimes, I mean, even just talking to him though, just if we're just talking about dinner or the kids or whatever, I'm like, you know, it's been a while since we've seen each other. Like we've had that conversation today, and I was like, so should we like try to make out tonight or tomorrow? Or,
That's sweet.
you know, it's
Yeah.
it's not romantic to pencil it in, but we've come to the
Right.
point where we've had to schedule it. Like, I mean, honestly, I'm like,
Yeah.
so are you gonna be tired on Friday night? You know, could we make out a little bit or something? Just because we've just gotten to that point where we've had to like seriously put it in our phones and be like, try to be awake at 9:30 so that, you know, I
Yeah.
know that we're still married to each other.
Yeah.
But if anybody else has any ideas, I'd love to hear them.
Okay, I'll say something real quick. So there was a time where during my recovery where I really didn't think of sex. I didn't feel sexy. I've always looked at myself as, you know, pretty decent. And I used to like looking at myself. And then I had a hard time not looking at my breast. And then I'm finally okay with it. Anyway, long story short, if you start to look at yourself and you start to put yourself first every day, and that means in every aspect from your mental wellness, physical, sensual, then when you're with your partner, it makes it a little easier to be with your partner because you're really liking yourself and you're feeling comfortable in your skin. So I kept having sex and I wasn't having an orgasm because I was tense. I wasn't relaxed. So then I thought, well, I don't want to, you know, drink and be doing drunk sex because I'm not a big drinker in the first place, but I thought maybe that might relax me. And it did. I had a couple glasses of wine and it helped. But the more I would walk and the more I would focus on myself and meditate. And then when it came time to being with my partner and I would, you know, I honestly, I ended up like having a glass of wine and maybe eating a gummy, something that's going to sedate my body and relax me. That gave me a little more confidence and it helped me during the intercourse time and keeping my bra on and buying like pretty bras and panties also helped me as well. I haven't had to use lubricant yet. I mean, I'm going to definitely check it out, but I think most importantly, it's like looking at yourself and trying not to look at the flaws, but looking at your beauty with whatever it is that you find in yourself. And then when you're around your partner, it's fun to flirt and you're right. You can't just say, oh yeah, like tonight we haven't had sex in a week. Let's just have sex. Cause then it's not, for me, it's not meaningful. So, you know, for me to build myself up to that, I kind of flirt with them. And, you know, when I'm around him, I'm really, you know, very touchy feely. And then he's, you know, and he understands that it's taken me a while to get to the point because it has. But I've gotten there. So don't give up, ladies. You will get to that point. Love yourself, wear your pretty bras, put on your makeup and do it every day. Just not on the days you want sex. Do it every day. So that way, whoever you're with will see that you're starting to feel comfortable with yourself and then they feel comfortable with you. And then it brings out all those feelings. Cause my mom always tells me where there's ashes, there's flames. So if you have had flames with your partner and the ashes are on the floor, there's flames again. You will get there. I promise you.
Well, I've just had an interesting experience because I'm also I've recently been being treated for bladder cancer, and urologists have slightly different bedside manner from my wonderful breast oncologist at UNM. And also, I think are just not used to 50-year-old women in their clinic. And so it's been challenging. Like actually yesterday I had to go get a cystoscopy, and on all the paperwork it asks, it's their sort of review of systems that they ask you before you go in. And, it asks, are you tired? Are you sad? Do you have chest pain? Blah, blah, blah. And one of the things is, do you have vaginal dryness? And I marked that yes. And of course, nobody said anything about it. It wasn't addressed. I don't know that anybody looked at it. The resident may have looked at it, and he was like a 30-year-old guy, and he may have just sort of gone, egad, I'm not talking about this. And so that's sort of added to the whole picture, where I feel like there's sort of like two aspects of what's going on. And I worry with the vaginal atrophy from the tamoxifen and all that stuff, and then getting bladder chemotherapy directly into my bladder. My urethra is kind of pissed off, literally and figuratively. It just sort of, it complicates the picture. And so not only do I not think about sex, I just, don't want to, even if I do think of it.
I'm really sorry that happened to you. And it's
Yeah.
very common, Pete, that, here you are really trying to hang on to your sexuality, and you're not even recognized as, by the medical profession as being sexual. And I'm on a crusade on North Campus, by the way, I spoke to the medical students this week, and yeah.
Good.
Anyway, but I to address the former part, the more we think about sex, the more we think about sex, just like the talking. And so that's where it really has to become a practice, so that, maybe you are going to set that date on your phone to have sex, but all through the week, it's like, God, can you spare 10 minutes to go in a room and close the door and put on earbuds and crank some music and dance, like just be in your body and be as goofy and sexual as you want to be, but to like reclaim your body. And can you find 10 minutes to read some steamy, racy story online that you're like, woo, I haven't thought about that stuff in a while, right? It's getting your brain back and your body back in the game. And I loved what Antoinette said. You have to do it every day. And then when the sex comes around, you're ready. So the lidocaine might be helpful for you on your urethra, because if you do have sex, that can be pretty sore. Getting it just on that urethra, a Q-tip or something. But anyway.
I wanted to say that it's interesting how we're so hard on ourselves about our sexual appetites. If we want to be good at something from the time that we're born, basically, what do we do to get good at it? We practice, we put time aside. And if we want to be good at sex, like if we want to have a good sexual appetite, what do? We expect it to just be there, right? And so it's this interesting thing that we do this only for sex. Like there's nothing else. You want to be a good cook, you cook a lot and you play with lots of ingredients, right? But if you want to have great sex, we expect it to just happen. And so I think like what everyone's saying here is just, practicing. It's okay to practice. Like you want to be more into it. Well, then setting time aside 10 minutes a day, if you set 10 minutes a day to stretch, you're going to be more flexible, right? So I think it's the same idea. And just feeling more sensual. I just love what everyone's been sharing. It's been really awesome.
I just wanted to
Thank you.
I'm into. Can you guys hear me?
Yes.
I was in the car and I'm on video now. But anyway, I think where I'm really struggling, I'm feeling very just totally out of touch with people in general. I just feel like I can't relate to people at all anymore. And I used to consider myself very feminine and really strongly identify with the female part of me, and enjoyed looking pretty and putting makeup on and just doing all of these things, feeling very feminine and always feeling like I had some sort of sex drive. And I don't have a partner, and that's part of my issue right now. I don't have a partner, and I don't know if or when I ever will again. After going through breast cancer, I had my ovaries removed 2 weeks ago. I've had a double mastectomy. I've been on an AI now for almost about 6 months. And so not only am I not feeling any sexual desire, I don't even care. And it just makes me feel so abnormal. Like I don't even care about it. And it's so weird for me because I used to care. I used to want to feel sexual and sensual and all of these things. And I feel totally like asexual right now. And it's just such a weird place to be, and not having a partner. And then I don't know. I feel like I'm kind of a mess with that right now. Like I'm just feeling so strange, not like myself at all anymore. Like I've just turned into just this asexual person, and then I don't care. That's what's really weird. I just don't care about it at all. So I don't know if anybody has any insight on that or can relate
It
at all.
sounds really hard. That's a lot. That is a lot. And especially, given the length of time on the AIs and the recent surgery, I do encourage you to try to maintain as much vaginal and genital health as you can, because it's easier to keep it going rather than to get it back.
Okay.
And do other people have it? Do you go by Rebecca?
I do. And I'm only 45, and I was not in menopause before this. And now I've been in menopause now for probably almost a year.
Mm-hmm.
It's just been.
And has anybody talked to you about that in the medical world?
Oh, and I actually had talked, before I had my ovaries removed, when I was at the clinic, I go to UNM. So I saw Dr. Adams and Katie M, I think we had talked about seeing somebody just to kind of like, just because I'm like, I know I get hot flashes. I knew about the vaginal dryness, but the whole mental thing for me and just the totally lack of desire and the lack of caring is kind of getting to me. No, I haven't talked to anybody about it.
That is,
my
that's
friends who talk about sex and their partners, and I'm like, I can't even relate. I just feel so not sexual.
I so totally know where you're coming from, Rebecca. I mean, that's sort of what I was getting at with, not remembering to have sex. It's just, I used to like it and think about it and, I used to consider myself fairly sexual. Now it's just, I don't really, when it happens, fine. If it doesn't happen, all the better. And it's just a very, very strange boat to be in, because I also was in menopause when I was treated, and when you get like hurled into menopause overnight at 100 miles an hour, I think that certainly contributes to the odd feelings.
Yeah.
And they're real. I mean, those hormones do affect our brains and emotions and thoughts and feelings about ourselves. So
I think sometimes it's nice to just know that we're not alone in that. I mean, Rebecca, I can totally relate. And I feel like, any intimacy that exists within my marriage is for my husband's sake, right? Like I do it for him, but if it was just me left to my own devices, it wouldn't happen at all, because the thoughts aren't there, the desire isn't there. And I think, I'm supposed to be in my sexual prime in my early 40s, right? I mean, so they say, and all of a sudden it's like a light switch that somebody just, put out the lights, and, what can you do with it? And so, it's just, I think even though it doesn't change, I think it's nice to be able to talk about it and, be able to relate to one another and know that we're not alone on that.
Yeah, I don't know why.
And when you said that it's there for your husband, I so I only have sex from the waist down now. And that's just what that's, I mean, it's all I can give right now. It's all I can do right now. Maybe eventually we'll get back up there, but right now we're staying from the waist down. And it's because I don't want this to sound bad, but I force it because I'm married, because not that I owe it to him and he doesn't make me ever feel that way, but I do it for him.
Right.
And before the ovaries came out, I used to like sex. And then the ovaries came out, menopause came, and the thought of having him on me when I'm sweating already, I'm just like, please, the last thing I want is for you anywhere near me. But, you know, I just keep my shirt on and I go. And but I know what Rebecca's saying, and Allison and Alex, I know what you guys are saying. It's the mental part too. It's I just the mental part is hard. It's hard. And I have to remember I'm having sex, and I have to remember that he needs to keep his hands below my waist. And so I'm trying to keep his hands down here and looking like I'm having a good time, and I'm trying not to sweat. And I'm just like, I don't know if I'm sweating from all that the wonderful activity, or I'm sweating just because I'm so nervous that something is going to go wrong. So I don't know. I'm there with you guys. I'm there with you guys.
That's where the yes, no, maybe checklist can come in handy too, because you can go through that checklist and your husband can hear in a non-sexual environment, no, I don't want you to touch my breasts. And no, I don't want you to touch my belly. And no, I don't want you to, and then he has to take some responsibility for playing, staying within those lines, right? I do want to ask, and again, this is where my naivete of, I haven't walked this road. Tell me about the benefits of, if there are some, of the intimacy. Like, what do you get, or is there anything that you get out of sex?
I feel like there is at certain times, the intimacy, just sort of the coziness, the sort of feeling like I'm like my husband is totally focused on me and enjoying being with me and looking at me is valuable. So I think that's a really good thing. I mean, I used to like to snuggle. I now don't anymore because he's just too hot in bed, and I don't want, I would rather snuggle with an ice cube than with a human being at this point. But I do think that the actual like closeness of being sort of body to body is still, that's what I get out of sex.
So the 3-minute game, I'm going to bring that up again because I think it's a good place to do that. It's a really great way to have that intimacy without the pressure of sex. Because I think that trying to put myself into some of your shoes, I would feel a lot of pressure and not feel ready, it sounds like. And I think that because I'd be concerned about not leading on or not wanting that and that pressure, I would then like push my partner away, even though what I want is that intimacy. And so the 3-minute game is like, it's a way of communicating, which can be really hard, about your physical needs without having that pressure. And like, you can explicitly say, the first 3 times that we play this game, it can't be about sex. It's not about sex. It's about,
I'm going to interrupt Elizabeth and
Yeah,
just say,
go ahead.
in the 3-minute game, you basically say, what your partner asks you, what would you like to do to me for the next 3 minutes? And you get to say, I want to play with your hands, you know, and you're asking, so there's 4 questions that get asked back and forth, and it happens for 3 minutes, and you time it, and you know, your partner says, hey, for the next 3 minutes, I would love to like run my fingers through your hair. Can I do that? And you get to say yeah or no. So that's what you play.
Yeah, it pushes you to kind of think about how you can be physical with your partner, but not necessarily to have sex with, like, to have that goal of sex, and how you can be physical in other ways other than sex, which can be hard, especially when you're in long-term relationships. It becomes like, you know, as a teenager, there's lots of other things that you do, but then all of a sudden, as adults in long-term relationships, it's like just penetration. And it's not just about that. Of course, if it's just about that, then, you know, then we're not going to be wanting it all the time.
And to answer Jane's question, what do I get out of sex? That time during sex, I forget that I had cancer. And so I remember what it was like when I was normal. I get that out of sex. And that part's really nice for me. Because then I get to forget everything else that's going on for that time.
Thanks. So if I can ask, how do you have any practices? Do you have any ways that you reclaim your bodies?
Well, I got a tattoo over my mastectomy.
Yay. Yeah.
Which was a really awesome thing. Although my husband doesn't like the tattoo, which is a bummer for him. But I like it, and it did sort of, it let me do something back to my body, but that I actually liked.
Yeah.
I dance. I love to dance.
That's awesome.
One thing I've recommended, this may sound a little goofy, but I really have recommended to victims of abuse or sexual violence is just touching themselves or masturbating and chanting their names, you know, as just a way of reclaiming. It's like sending your identity and your energy through your body. So I offer that one.
And I think, like, if you're not ready to masturbate, because a lot of people, you know, don't feel sexual at all, so maybe, you know, that's like 8 steps ahead or whatever.
Yeah, I mean, it can be just touching. Yeah.
But one thing I could think of is just looking at yourself, becoming comfortable with yourself. So taking a mirror and looking at, what does your chest look like now? You know, like, look at every little detail. Look at your vagina. Look at your vulva. Look at all the parts of your body and really just look.
Is that hard?
Mm-hmm.
No. Yes.
No, it's not.
I don't think it's hard. I don't, and when I look at myself, I don't think of my body as bad or ugly, or I don't talk negative, or I really don't think anything. For me, I just kind of like, okay, well, it's fine. I don't think anything really negative or positive about it. Yeah, for me anyway.
It's just not sexual. Yeah.
Yeah, just not sexual, but I don't like look and say, oh, I don't like myself, or I mean, I think if it's like I've changed. There's some things that I don't like. I mean, I definitely don't feel feminine, but I don't hate it.
And let me just say that a lot of women go through times where they feel very unsexual, especially after childbirth, when they don't have time to think about sex. A lot of women go through difficult times around menopause, and a lot of women stay sexual after menopause. You know, some of your effects are the effects of menopause, and some of your challenges are beyond that. The hot flashes will tend to get better. So long are they going to last? I can't tell you. There's, they can last 10 years, they can last 2 years. But they will tend to get better. The vaginal tissue dryness tends to get worse over time. So you won't always be sweating when you're snuggling with your partner.
I also, sorry, go ahead.
Oh, I have a question. Lori, I think her name's Lori Nelson, had a class, a sexual health class. And so she also dropped off some samples. I'm not sure if she took them to everybody's houses, but I had asked her about them. And in that packet, there was a moisturizer that I really liked, because I've been using the one from, well, I get it at Target and I can't think of what it is, but it's really like liquidy. And I feel like it doesn't last very long. But the other one that was in the packet, it was like in a purple or black kind of little packet. That one worked really well. It was like thicker. Do you know what that was called or where I can get more of that?
So the one from Target is Good Clean Love. They make 2 different moisturizers, and one of them has hyaluronic acid, and I don't believe the other one does. So if you liked one more than the other, it could have just been that you had one without the hyaluronic acid. I'm not sure what the other one is that you're talking about, but I think you're talking about Diane Nilsson, who's the breast navigator at UNM. And I'm sure if you reach out to her, she can tell you what the name of that moisturizer is, because I'm not sure based on the package. Or the other option would be to go to like Amazon and just kind of look around and see if any of the packaging looks similar. But I would recommend just going to Diane and asking her which ones. I'm sure she'd be able to tell you.
Okay, I think it was actually the Replens, and just overall that made a difference, even in just me feeling more interested in sex. All around, it was really helpful. But it was more of like the Replens is really liquidy, whereas the other one lasted longer, and it was just better.
Sorry, I'm not familiar either, but yeah, I suggest that you go on and just look up images until you recognize the package.
Thank you.
So you were saying to do the moisturizer like you do a lotion. Is this?
Yeah, so it's inserted in the vagina. So
Okay.
you wouldn't just put it on the external part called the vulva. You would put it inside the vagina. Often it comes with an applicator, but not always if it's a cream. But there's also tablets. There's all different ways that you can, I think actually, I don't know if moisturizers, I think maybe moisturizers only come in cream form. Do you know?
I don't think they come in tablets.
They don't come in tablets.
I don't think so.
But you basically, you put them inside just like, I don't know if you've ever used a tampon, but that applicator is kind of like a tampon. And then I would recommend doing it at night because it does kind of absorb and then it will ooze out a little bit. And I would start by using it frequently at first, kind of like a bolus dose, like an extra amount at first. And then you can, after a couple weeks, use it a little bit less frequently and see how the vaginal tissue feels to you. And again, that's not just for sex, right? It's for anyone. So, even if you're not feeling sexual and not sure if you're ever going to have sex again, which is totally okay, I would still recommend using it because it can help with those like vaginal tissues. Just because you don't want to be sexual again doesn't mean you can't keep your skin nice.
And that thin vaginal tissue and labia and stuff, it can tear and get sore, and some people, like if they wear tight jeans or something, it's irritating. So just want to keep it healthy.
I was gonna say before, I just think it's really important to say that it's okay to not feel sexual. Like this whole talks about sexual health, but it's also totally fine if you don't feel sexual and you don't want to do anything about that. that's 100% fine. That's and as long as you're happy with that and that doesn't make you upset, then I don't think that there's anything you need to do. Some people live their whole lives like that. If the issue is if you're not happy about it, and then I think some of these things that we talked about are things that you can try. But if it's something that you're okay with, you know, neither Jane nor I are here to say this is the way you should be.
Andrea, if you find out the name of the product you like, can you share that with us? Please?
Yeah, definitely. I'll text it. I know I wrote it somewhere, but I just couldn't find it. But the applicator for that was similar to like what a tampon is, and the Replens is not like that. So when I do, I'll let you know.
Thank
And
you.
Andrea, I turned on the chat feature in this particular event. So maybe throw it in there too, because it'll be more relevant to the people that were in attendance. Because not everybody's on the text group, because we can only do 32 at a time, and people with Android phones tend to get kicked off, and then I have to start new groups and loop them back in. But if you put it in the text, put it in the chat as well, if you don't mind.
Okay, definitely.
Anything else that anyone wants to bring up before we wrap up?
Allison?
Yes.
I just wanted to ask a quick question. I know I'm on 2 medications and I always forget the name of the medication that I get for the monthly injection. And
I believe you're on Zoladex for that.
Okay, thank you. Yes, because the other one's letrozole and I could never remember Zoladex. But anyway, I was reading that the Zoladex can give women a vaginal I don't know the exact term, but it's vaginal bacteria kind of.
Bacteria vaginosis?
Yes, that is it. And so if you're experiencing that, you tell your oncologist right away, because then that might help eliminate some of the smell or odor you might be experiencing.
Yeah, so it would make your vagina susceptible to bacterial vaginosis, and that can cause kind of a grayish, watery discharge and a fishy odor. And if you're having sex with a person who's ejaculating in the vagina, it can really cause a fishy odor. And there are medicines for that, yeah.
Oh, I smell like medicine. I don't smell like fish. Just
No.
No, I was just putting it out there in case there's any
tear
kind
that
of
up in the room.
a different smell or something we're not used to. I know that I was researching because I was, concerned about the side effects. I did read one of the side effects of the Zoladex.
That's good to be aware of. Thank you for sharing.
You're welcome.
Feel free to reach out. I mean, I can offer myself. Feel free to reach out to me if there's any follow-up questions or information you want.
I have another quick question.
Sure.
Do the moisturizers, do they have estrogen in them?
No.
That's something we need? No, they don't. Okay.
No. And in fact, you would want to try moisturizers for sure before you consider any kind of hormonal medication.
Okay.
Right. And sorry, Annie, we did not make that clear. No, they are non-hormonal, non-medical, over-the-counter, and really safe.
Okay.
And the studies show that if you use them consistently, they're effective, and they're almost as effective as vaginal estrogen for some people. I kind of question those studies a little bit.
Okay. Thank you.
And I did want to include that in the body of the invitation and Hobnob, Jane's email is also listed there. And then, I don't know, Liz, do you maybe want to add yours to the chat just in case anybody wants to reach out to the two of you directly?
I'm not sure because I am a provider and an oncology provider. I don't know yet how I've never been asked that before, and I don't know,
Okay.
to be honest, how I feel about it yet. So I'm gonna have to think about it.
Okay, no, you don't need to share your email if you just want to have questions go through Jane. Jane's is already shared, so that might
Yeah,
just
Okay.
and I won't be giving
Now I'm
medical
bright red.
advice, believe me.
no, I didn't want to like
And I'm not red at all. And then we talk about my email, and I go,
it's totally okay. I just didn't want you to feel left out. But James is already in the invitation, so as long as you guys have a way to, you know.
No, I think that's probably a wise thing, Liz. And that is kind of ironic, isn't it? Yeah, I mean, I'm not going to weigh in on a personal decision around certainly a vaginal estrogen question or anything like that. That's not my place, but I can tell you my favorite lube, you know. All right. Well, thank you, everyone.
Thank you both
Thank
for
you so
sharing
much.
your time and knowledge with us. It was really, really lovely and helpful. And like I said, we'll put it up on our YouTube channel. And just thank you for being here.
Yeah, well, I really appreciate you, opening up and being vulnerable and sharing. So
Thank you, ladies.
Thank you.
thank you.
Thank you.
Thank you, everybody.
All
Good
right.
night.
Good night.
Good night.
Thanks.